פעם שעברה מישהו נתן לו מים באמצע הוועידה?
זה כבר רץ בשידור.
מה רץ בשידור? אין בעיה. בלייב אתה מתכוון? בפייסבוק? מה זה אומר לתת לו את המים?
Hi everyone. It's good to see so many of you again, and thank you. Indeed, this is a world in crisis. We are now at the second coronavirus wake-up call webinar, and I have to say that many of you have been amazing after the first seminar. So many of the connections were made, startups. We want to say thank you to so many people in New York and in Italy and many startups around the world and in Israel for connecting to each other and enabling new technologies and new ideas to be useful in real time in some of these areas. We thank you, and you gave us a big inspiration again to come to the next meeting. And today we're going to focus on the people who are standing on the front line of many of the issues, the medical staff. The medical staff in each of the hospitals, the medical staff that is checking the people, that is treating them, that is doing it with tremendous risk to themselves and to their families, but still are doing it in a way that is an inspiration to many of us. Once again, we're going to speak to people from around the world, from Italy, from Spain, from Brazil, from New York, from New Jersey, many people from Israel again. And we want to thank you. We know that so many of you are on this call, prominent individuals, each one of you doing what they can in their own country, with their own people, giving a hand, giving help to many of the people that are trying to stop this virus. We are seeing that public policy and medical treatment go hand in hand, and sometimes even when you have the best medical staff, without the right public policy, you can lose control on what's going on. So therefore, once again, the webinar that we're having is going to bring together people who are on the technology and on the medical front line, and people who are making policy in different countries, because what we are looking for is international leadership that will know how to close its borders and protect its people, but will also know how to connect with others around the world and use best practices in different areas, in different hospitals, in different regions, so that they can intercept some of the world's most dangerous problems that are arising now in so many places. We'd like to start with a parliament member from Italy, Mattia Moore, who is doing a lot in Italy, trying to bring together solutions and innovation, and is connecting to others. Mattia, we're so honored to have you here today. Please tell us a little bit about what's going on in Milano, in Lombardia, in the different regions in Italy. It seems that you guys are overcoming in different areas some of the crisis. Tell us what you're seeing from your standpoint, and where do you need a call for action and a call for help?
Well, thank you so much for inviting me. The honor is mine, because I've been for 15 years an entrepreneur. I work in tech, I work in the startups world, and so it's just the last 2 years that I'm in the Italian parliament acting as a politician. So for me, it's not much more coming from your world than from the political one. Now, in the last years, I mean, everything that I'm trying to do, and I'm still trying to do, is like to push as much as I can the tax system in Italy. A tax system that now has a hard challenge in front of us, like before this crisis, everyone is living unfortunately in this moment. And Italy has lived it, I mean, as you know, even before than other countries, except China. And we are like in the front line, so we saw the first like bad results of that, but we are in some way seeing now the end of that. We are going to the end, we are going to the restart of the country. So Italy, we don't know how happened that Italy started so tough to have to be hit by coronavirus. What we know is that Italy has a really strong and serious and very well done national healthcare service. So Italy, historically, Italy and the country has always spent a lot of money with like very important professionals, doctors and nurses in that. So that's the first point where we start from. And so, and this doctors, people is really fighting the virus in an incredible way, like on the first line, and like almost 80 of them died in the last month and a half. So it's, we're paying a lot with their lives to what they're doing, but they are facing the virus, and the country now, it's in some way the numbers since the last few days, the last week, I would say, are decreasing, personally, and yesterday we had a higher decrease, so that means that the lockdown that started exactly 1 month ago, the 8th of March, it's working. All the countries in the world are like following the same example. They started lockdown in a different moment, and lockdown seems to be working. But
that's so encouraging. That's so encouraging, Mattia, because
this is encouraging.
Italy is a country that so many of us around the world love so much, and the pain of the country was so touching, and the fact that you're saying that maybe the curve is changing even a little bit is giving many of us a sign of encouragement.
When you see the data, you see that the curve, it's really the same for Italy, for Germany, for UK, for America. So what we are now seeing, that the lockdown is working, but there is not only the lockdown to face the crisis. So what we have to do now, and what also we said and we put on the government table, it's to decide. Putting together innovation and policies, decide how to restart, how to live together with the virus, because we know that we have to live with the virus till when there is going to be like a cure or like a medicine for that. And so we are now planning to when to reopen factories, how to reopen, how to guarantee like security for the employees, for the workers, but because we want to fight the virus, but we cannot block a country for 6 months or 1 year and let the people like coming more poor because of the virus. So this is like a challenge for all over Europe, for all over the world. And so as we know, this is a crisis that's like putting together all of us all over the world. So we have to find a solution that should be the same for all the countries. So let me give you just a few examples about how technology, it's like helping us to face it. So we have, for example, an incredible startup in Italy, in Brescia, that is one of the cities that has been more hit by the virus, that in a few days of studying, they managed to print 3D bulbs that was being put together in a snorkeling mask to use it as a device to let the people use it as a ventilator in a hospital when the hospital were running out of ventilators.
That's great.
This is it's a very simple solution that has been used by all over the world. Like this is a small startup that is now receiving orders, and they cannot follow the word either from US, from Germany, from Tunisia too, so from all over the world.
Thank you. Mattia, thank you so much. This is one of the things that we will be talking about after Passover or Easter is how hopefully we will be able to talk about how communities in the business can come back to work together and revive some of the areas, but we'll talk about it as we go. And I just wanted to move forward to Brazil, just to get a different perspective from a different continent, to Igor Nogueira Calvet, who is the president of the Brazilian Agency for Industrial Development and who's responsible for a lot of the public-private cooperation around this effort. Igor, please let us know a little bit about how it's going in Brazil, because Europe was the focus, the US is the focus, but actually South America, Brazil, some of the other countries, you guys are having major challenges. Tell us more about it.
Hello, everyone. First of all,
I think you're on mute. I think you need to get yourself off mute. There you are.
Can you hear me?
Yes, now we can hear you.
Okay, hello, everyone. First of all, thanks for
Igor, your line is
very brief.
Igor, your line is problematic, so your image is coming very vague, and we don't hear you very well. And so maybe what we will do is we will go to someone else and come back to you. Maybe you can see whether you can connect in another line, because we cannot hear you.
Okay, I'll do it.
All right, now we'll come back to you later. We spoke about Italy. We're speaking about Brazil. We're now speaking about Spain. Spain is undergoing major challenges. And we have with us Raul Blanco Diaz, the Secretary General for Industry and Small Businesses Enterprise from the Minister for Industry and Trade. Raul, it would be wonderful if you can tell us how Spain is coping and what you are doing in order to overcome the crisis.
So thank you very much. Thank you very much for the invitation to this interesting meeting and conference video call, because it's very interesting during these days to share opinions, to share targets, to share goals, and to share future policies, to not just current policies to cope the actual situation, but future policies of how to solve the future economic situation. So, first of all, and very briefly, since from the Ministry of Industry in Spain, we are facing the health crisis, the COVID-19 crisis. So at the first moment, since the first moment, we have been working with the Spanish industry and with external providers in order to have anything that we need to cope this situation first. So that means masks, that means ventilators, that means medicines, etc. So this has been the first point 2 or 3 weeks ago. Afterwards, we have worked with the Spanish industry in order to have enough providers, national providers of all these things, because industrial relocation is one of the main conclusions, main of the concluding remarks that we have from the actual situation. We need, our countries need to provide itself the different value chains, not only in pharma, but also in technology, in health technology, etc. So foster the national industry, foster the European industry, and also foster industrial partnerships with other countries like Israel, Brazil. We are talking also Italy, a colleague was talking before me, is absolutely necessary, because we cannot manage this situation and the future situation generated by the COVID-19 without public-private partnerships, wide private-public partnerships, but also big partnerships between countries, because we cannot permit, we cannot allow again situations that we have been living during the last weeks. So finally, this point of view of industrial relocation, fostering industry in our countries is very, very relevant, because we should not be dependent of another countries, etc. So we have to recover the value chains, the industrial value chains, in order to have more solid economies. And I think this will be the work that we will be doing during the next months, during the hard weeks and months that we are expecting. But afterwards, the recovery of this situation, I'm sure that it passed through the industry, technology, and partnerships.
Thank you. Thank you.
Thank you.
Thank you so much. This is inspiring, Raul, and we'll continue the cooperation. And thank you so much for your words and for your efforts. And what Spain is undergoing is, I saw that you are from Catalonia, but you're actually in Madrid. So you're bringing together Barcelona and Madrid. And
yes,
if anybody can do that, they can take care of anything.
Yes, I'm living both sides, so I'm suffering nowadays. I'm suffering for both sides. So, fortunately, the last data on the situation is a little bit better. So we hope that next days we will be improving the situation a little bit. But we have to fight during months, and we have to improve the economical situation during the next months. And as I said, industry, technology, partnership will be absolutely relevant in the next future.
Thank you. Thank you so much, Raul. Thank you. Igor from Brazil, are you on a better line now? Until Igor comes on, I just want to say that we have with us some amazing people, and I cannot, and a big number of people, but some of them I just want to point out. Stu Eisenstadt, the Senior Counsel at Covington Burling, the former Undersecretary of State. We have Renato Soro, who is a good friend and was the governor of Sardinia. We have Linda Mireles, who is the chair of the New York Federation. And we have Agnès Touraine, who is a good friend, was a partner, and was also the vice chairman.
Celular, então. Não, eu vou tentar entrar pro vídeo. Não, que eu tirei.
Okay. And Agnès Touraine, who was the vice chairman of Vivendi, and we have Angelica Berry, who is a great philanthropist from New York and is doing great work around the world. Thank you so much for many of you who are joining. And I wanted to go to a doctor who is actually on the front lines in the University Hospital in New Jersey. And we wanted to hear from you. New Jersey is the second state that is hit the worst in the United States. How are you guys coping? Rotem Naftalovich, how are you guys coping, and what are you seeing from your standpoint?
Thank you for having me. So New Jersey is just a few miles from New York City, from Manhattan. It's across the river. It's the bordering state to New York. And like you said, it's the second highest with the numbers in the U.S. And we're seeing that the numbers are going up every day. Now we started seeing this week that more and more healthcare workers are dying. So that's adding to the stress level and the panic. And combined with this, there's a big shortage in the PPE. So altogether, it's not a good situation. New York has been hit much harder than us, but people here believe it looks like New Jersey is going to follow the curve of New York City to some extent. So that's in a nutshell where we are. I think there's three lessons or points that I can share with you in terms of from the doctor perspective, in terms of what's going on. The first is that the guidelines from the CDC have changed enormously over the past few weeks. So the physicians really go by what the guidelines are. Usually these are guidelines by professional societies in the fields or governmental guidelines. The CDC is the major organization, the government entity in the US that creates the guidelines. And essentially what we saw, which is, it's very interesting, it's like the guidelines from the CDC changed so extreme. They went from, initially it was something along the lines of if you were exposed, you should quarantine yourself for 2 weeks. And very quickly, it became not practical to follow these guidelines. They were just, we had in our hospital a bunch of people that were exposed early, and very quickly you're going to be left with nobody in the hospital to take care of the patients. So in a matter of days, it became clear that these guidelines are not practical, and the CDC changed them, and they kept changing the guidelines every few days. The guidelines would change. It went all the way to wear a bandana on your face. So it became such a swift change in the guidelines that, in a sense, I mean, it's very sad, but in a sense, it was almost comical about how little insight the CDC has had about this. And that leads to the second point with the shortage of PPE that the whole world is experiencing. The fact that the CDC had so little insight really did not put them in a position to prepare adequately for this, with the PPE. And the second point I'd like to make is that we're not really using the PPE adequately, and we're still too short of the PPE. And these masks and stuff are really designed to be used disposable, one-time use, and then you chuck it. And now we're at this point that you get one mask a day, and you may not have a mask when you go to intubate, but we're kind of hovering over this point where you can get a mask a day. You can figure out someone that will in the hospital get you a mask a day, and you're around that level. So you have something. You're not going to these intubations with nothing, but you're really not using it properly, and we're still too short. So that's a problem. And then the third point that I can share with you is that the U.S. healthcare system is extremely fragmented compared to other places in the world. The U.S. is extremely fragmented. Most doctors that work in a hospital don't work for the hospital in the U.S. They're not employees of the hospital. There's a lot of private practice groups. And in that case, it becomes much more difficult to coordinate, especially when the guidelines from the CDC at the top are changing so rapidly. So then it doesn't become the most efficient strategy.
Rotem, just a word to summarize. Are you guys in New Jersey, and I understand it's very fragmented and it's different, are you guys able to cope? Yes?
Yes.
Okay. And are you seeing a change in the direction? I mean, or it's still becoming worse and worse from day to day?
Becoming worse and worse, but right now the hospitals are able to ventilate the patients that they need. We converted a lot of the floors of the hospital, became additional ICU spaces. The operating rooms have stopped working. We haven't been doing any surgeries that are not emergent in about the last month almost. So we kept the hospitals very empty. And this, the US actually did very impressively. They were very early to say, stop doing all procedures in the OR, stop doing anything else in the hospital that doesn't have to be done and is not an emergency. And that we probably kept the hospitals empty about 2 to 3 weeks before the wave really hit. So that was useful.
Thank you.
But nobody knows how high it will be.
Yeah. Rotem, thank you so much and good luck to you. I wanted to jump to the other side of the world, to Haifa, to Rambam, and to talk to Julie Zehavi, an ER nurse in the Rambam Hospital. Julie, tell us, how is it going in Rambam, which is the main hospital for the northern part of Israel, and is seeing so many people and so many parts of the population?
Hi, Eden. Hi, everybody. Yes, I am an ER nurse at Rambam Hospital, the third largest hospital in Israel. Well, our job changed drastically. We are working in a totally different format. We now divide the sections in the ER into a totally different sectors, and we provide to the suspected corona infected people with 3 different sections. One is for people who will be probably discharged and will receive the results at home. The ones who will need to be admitted to the ER and take the basic care and probably will be discharged or will be admitted to the different departments in the hospital. And the ones who are in worse conditions and need to be intubated, and we also have a special room for those. So I feel like we are very well prepared. We are not short of equipment. We are having now special training for an underground hospital that Rambam is preparing, which will be able to admit still like 600 people if needed. So that's the situation right now, yeah.
Thank you so much. You're also the wife of Yitz Zehavi, who's working with us, and send him our very best. And we have a lot of appreciation for what you guys are doing, both him and you, and we're with you in the north. I wanted to go.
So much.
Thank you to a startup called Sonovia, which is producing antibacterial textiles that are used both for masks and medical equipment, but also for sheets and other textiles that are used in hospitals. We have with us both Liat Goldhammer and Rom Eliaz. Tell us a little bit about what you're able to do and how you're helping hospital copes with bacteria and with the virus.
Sure. Hi, Alex. Thank you for having us. What we do basically is we are trying to fight the antibacterial hospital acquired infection. And since the COVID-19 came up into our life in the last few weeks, we discovered that our technology is basically well protecting against COVID-19. We didn't do our own studies yet in order to show it. However, there are so many papers that show that our nanoparticles that we are using are basically RNA destroyer, and because they are RNA destroyer, they basically can kill any kind of virus. I really want to share with you our recent presentation for a few seconds. I will just be able to do that. I was able to do that. Oh, here it is.
I'm just reminding everyone that we now have quite a bit of speakers, so be brief and to the point. We'd really appreciate it.
Definitely. All I wanted to say is that our technology is using computation with really disruptive merit. We have ultrasonic applications that basically form cavities in the water, and once these cavities collapse, they basically shooting out or impregnating the content, which is a metal oxide. And currently we are using formulation of zinc oxide and sulfur oxide. And what we did is we have the capability right now to do A1 or A site in Germany. And because of the corona, we are not able to be there. So what we did is actually, you see here the line of coating that we are using right now for our A site in Germany. And what we did is we basically took our R&D material of that we run in our last run, about 5,000 meters of fabric, and what we really created, we created mass. We created mass from our R&D, and we are basically donating it to everyone. We just donated a lot to some of the hospitals and to the police, and we donated some of the mass to some of the municipalities here around Israel, and we are limited to the amount of R&D fabric that we have, but we are more than happy to do that. So that's what we are doing today.
Thank you. This is quite inspiring. Thank you very much. And I wanted to go back to Igor Calvet from Brazil just to see whether your line is better, Igor, and tell us how things are in Brazil.
I think it's good right now, isn't it?
Yeah, it sounds great.
Okay, hello everyone, and sorry for that. Thanks for the invitation, Ari. I'll try to be very brief and exposing the situation we are going through here in Brazil. Well, today, as you could see, we have over 11,000 infected people in the country. These cases are concentrated in the southeast region of Brazil, but nowadays 27 states of the federation already have confirmed cases, and altogether there are 486 deaths in Brazil, which gave us a 4% mortality rate, which is quite high compared to other countries. And we have an average, on average, a rate of 17% increase in confirmed cases per day, which is for Brazil also high. If I could highlight the main challenges we are currently facing, I'd say there are three. The first one is how to increase the capacity of the health system. Respirators or ventilators, masks, ICU beds. Brazil has nowadays more than 60,000 ventilators, and there are more than 16,000 ICU beds in the public system alone. The rate per se is not low, but the availability of these beds in the territory is quite uneven. Despite of this clear bottleneck, which is common, of course, to many countries, we have a health industry that includes not only medicines and pharmaceuticals, but also medical equipment. The effort right now is to expand the production capacity of existing plants and also to convert plants in other sectors in order to alleviate pressure over the system. The second challenge is unifying action in Brazil. Brazil is a federation, as I said, 27 states. Each of these states has competencies on health activities. There are more than 5,000 municipalities. It's really a huge coordination effort. Each governor or mayor has something to do or say about the pandemic. This is a problem. The last challenge, to be very brief, is to find new solutions for prevention, tracking, monitoring people in poor communities. As everyone knows, Brazil has also a high income inequality. This means that poor community have entire families living in small places, the whole family together, from children to the elders. We will launch, for example, at ABDI, a call for startups to find solutions that can alleviate the economic and social impact in slums. Income generation has been severely impacted in Brazil. Informal workers who did not access the state's safety net are now without income. And other diseases can obviously affect the slums, making the problem of COVID-19 more acute. And the kind of connection we are doing at this moment is really important. Perhaps we can find solutions we never imagined before. We can also help with our solutions. We need right now equipment, but everyone also needs. But we need all new solutions to overcome existing problems and also future problems. So
thank you, Igor.
Now at the peak, but I think we can find new solutions.
Thank you, Igor. I commend you for leading multi-ministerial efforts on the coronavirus issue across Brazil and across the different ministries. And thank you for everything you're doing. And we would hope to be more in touch and see whether more information and help could be exchanged. Thank you so much. And now I wanted to go to Professor Elchanan Bar-On, who is usually known for going into emergency zones in the world and setting up alternative field hospitals in situations of crisis. And now Elchanan is actually at the Sheba Medical Center, and now we need your capabilities in order to set emergency alternative hospitals outside the facilities. Tell us how you're coping and how what you're doing in Sheba could be a model for other hospitals around the world.
Good afternoon. Thank you for inviting me. Yes, I had the Center for Disaster Medicine Humanitarian Response in Sheba, and we usually deploy to disaster and non-disaster situations in developing countries, and I don't think we ever dreamt that our next mission would be establishing an emergency facility in Sheba. That is what we did, and I would just like to touch on a few points and be brief. We had our guidelines were, number one, of course, to diagnose and treat the corona patients while protecting staff. And I won't go into all the techniques, but there are many ways to protect staff and avoid the situation like we heard about in New Jersey or in Italy. But not less than that was to preserve the operational continuity of Sheba Medical Center, which is a quaternary referral center serving a large part of the Israeli population. And if we save 100 corona patients and lose 200 to heart attacks, we're not really doing the right thing. So a lot of what we did, and I'll give just some brief examples, is to really preserve the capabilities of Sheba to continue with the regular population. For instance, we selected our facility on the periphery of Sheba, and we converted actually a staff habitation area into a hospital. But this is really far from the main campus, and we really, except for very, very specific things like ECMO, we've not had to move patients into the main facility. We're protecting the main facility. The other thing is the way we set up our ER. We really see the ER as a guard dog in the entrance to the hospital. And what they have to do is to triage patients, make the arrangements for treating the corona patients while again keeping these patients from contaminating the hospital. And regarding the staff protection, so there's really many ways. Obviously, a very widespread use of PPE, a lot of telemedicine, a lot of the things we do every day we have changed and we've been doing, starting from rounds and a lot of other things we do by telemedicine. Then organizing the staff, we divided our staff into small groups, so if one gets exposed, it doesn't contaminate the whole department, but just a small group, and we work in small group. Shift transfer is done by phone with no contact between the group. Anyway, I mean, I won't go into the whole thing. And the last thing I want to stress is the importance of sharing the experience we've accumulated with other people, which is what we're doing right now here. But we've also been very active with our Palestinian neighbors. I went to a few places in the West Bank, and we've been meeting with the Palestinians from all around in order to make sure, because we're all in the same boat in this, and we really have to row together if we want to reach the shore.
Thank you so much, and I want to say that this crisis is also bringing people together in ways that we did not expect before, and your work with the Palestinians, and we have quite a bit of cooperation as well, and also with some other Arab countries, is something that we all realize that we're together in this neighborhood in a way that is very vivid. And just on that note, I just wanted to recognize and acknowledge that we have with us Randa Masri, the founder of CEO of Connect Me, a Palestinian that's also doing a lot of work in the United Arab Emirates, and her brother is a very close friend of ours, Bashar Masri, the founder of Rawabi, and an entrepreneur in his own right in a big way. We also wanted to recognize Jens Nielsen, the CEO of Bio Innovation Institute in Denmark, which is doing amazing work. Paolo Geraffo, the managing director of Dia Capital from Italy, who's a partner of ours and is doing great work. Boone Hong, NG, the managing director of international relations at Temasek. Temasek is the leading corporation investment arm in Singapore, which is a partner of ours, and we saw that Singapore was doing an amazing job in intercepting the first wave and then now the second wave of the virus, and we commend you, and we're learning from you. And then many others that I will speak about as we go, but I wanted to go to Terry Newman, who is the managing director of MCC Group in London, who's just put together 10 COVID-19 hospitals in Peru, and is doing work both in England and also in Israel. Terry, tell us a little bit about how you're helping people put a medical center from one day to the next, and how you're helping people solve problems where maybe they don't have the right infrastructure or the infrastructure is collapsing.
Good afternoon, Errol, and thank you for this. To those at different time zones, good morning and good evening. Errol, you started by asking the important question of what public policy should look like. So in the case of Peru, it's interesting to note that this was the 10 hospitals that we have just provided. We finished supplying them in September. They were designed before Corona was even contemplated. They were designed for two purposes. One was to increase the size of existing hospitals, and the second was to respond immediately to natural disasters, primarily earthquakes. I can show some videos afterwards. But those two purposes have been met perfectly, and so I think the Peruvian government deserves a lot of credit for what they've done. Now, when we are discussing with decision makers how we see the next 12 months playing out, we split things into 3 time zones. In the immediate period, we think that governments should be investing their money in converting existing facilities into separation zones. What is being called hospitals, what you saw in China or what you saw in Central Park, are not hospitals, they are separation zones where you are taking people who are infected away from the major part of the population. That should be done immediately, and it's being done, and we commend all those public policy makers who are doing it. In the short to medium term, and by that I mean in the next 3 to 6 months, governments need to invest money into proper medical facilities outside of the existing hospital campuses. There are lots of the population who are now scared to go to hospitals because either they fear they will not get the treatment because there's not sufficient facilities in the hospital, or they are scared that they will contract the corona disease. So someone with appendicitis, or, that is not a particularly dangerous disease, if treated, all of a sudden it becomes dangerous. So we think governments need to be thinking now about what facilities they will have in August of this year, in September of this year. And in order to do that, they need to start making decisions now, because in order to build world-class medical facilities with operating theatres, with labs, with ICU, with gynecology, with pediatrics, with cardiology, these are complex and sophisticated pieces of kit. And even when we're working flat out, it takes us 3 to 4 months to get these ready. And then when we're looking from the medium to long term, and now I mean from 12 months onwards, it is now accepted by most decision makers in the world that more civilians will die through pandemics than through war. Yet if you look at the warehouses that they have, they are full of tanks and missiles and armored vehicles, and almost empty of mobile hospitals, of protective equipment and ventilators. And if the purpose of the government is to protect its citizens, then it needs to change that process. It needs to start thinking militarily about how to deal with pandemics. So what does that look like? I'll split it into 5 things. Number 1.
Terry, this is fantastic, but just be a little brief.
Okay.
All right.
Sure. It needs equipment, it needs soldiers, i.e. doctors, it needs reservists, nurses, and it needs to do war games with germs. If it does all of those, it should be fine. We at MCC, I'll be happy to share with people afterwards. MCC Group London is the website. You can see lots of examples of our projects there. Thank you, Errol, and good luck.
Thank you. What Terry is saying is so profound and unique. And to us in Israel, we should probably listen carefully, because we have war games and scenarios for many of the defense industries and what we are preparedness for war. And what he's saying is actually very profound, that humanity and countries and public systems, public health systems, should be ready for pandemic, and should be ready and put the same amount, or maybe not the same, maybe half of the amount of preparedness that they have for war, for the medical crises that is happening now, and the ones that unfortunately we can be prepared for in the future. I wanted to go to Ravit Ram, who's monitoring, the CEO of Wellbeat, who's monitoring patients, how to treat chronic patients moving forward, both in the corona crisis and after the corona crisis, both in Israel and in Europe. Ravit, please give us a little bit of a sense and connect to what Terry was saying on public policy, and give us guidelines so we can be smarter.
Thank you very much for hosting me and for everything that you have done up till now. So I'm proud to say that today we went live with one of the HMOs in Israel in order to support them in a proactive engaging platform. And as you said, that unfortunately we have to focus also on patients that are under chronic conditions such as diabetes, cardiovascular, post-strokes, or other people, those populations that are with this. And unfortunately, they can't receive the that they received before, but if we want to continuously support them and remotely making sure that they will be complied to their treatment, we will see that they will decline in their health And as he said, we will actually with very high risk to this population. And this is why we actually combined this hybrid solution with services such as telehealth that some of the HMOs in Israel have, in order to make sure that we actually understand the root cause of the behavior of each and every patient, which is something that we can do with Wellbeat hybrid system. By sending an SMS to the individual, we're actually analyzing the behavioral path and the behavioral profiling of each and every individual and understanding his uniqueness, and immediately can actually present it to the therapeutics in order to make sure that his interaction with the patient will be accurate, efficient, and effective as possible, even when we are doing it remotely. We still want to create the same relationship as he was if he was in front of us. We want to make sure that he will be engaged and very proactive to the treatment that he has. After that, what we actually do, we receive feedback from the expert in the middle, which is the therapeutics, and then our AI is actually measuring quite a lot of data on the behavioral path of the patient. The expert in the middle, the different IoTs, and of course, what we actually see from the interaction that we had with the patient. When we see that the patient is not staying on the regime as he was supposed to, we actually use the machine learning that's looking for personal traits that are similar to the one that we are looking at, and by that we'll measure what was working well for them. We'll receive also, the management will be able to receive what we call a red flagging. And by that, for example, we did it also at Shiva Rehabilitation Center, when we red flag and they added another call by the telehealth that was tailored by Wellbeat, and we could actually show the Shiva Rehabilitation Center how we triple level of adherence from 25% of patients that were supposed to come to the rehab to 75%. We did something very similar on Pittsburgh, Pennsylvania, on senior people, and we showed again how we can double the level of participation and engagement of those kind of people. We have to look at a different approach. We have to look deeper of the cause of why people are behaving in a certain way and not another, and by reflecting it to the therapeutics, reflecting it and actually navigating with the right omni-channels with each and every individual, using the right drivers and approach, we can actually optimize the care.
Thank you. Thank you so much, Ravit. This is really inspirational. And now, from Israel, I want to move to Miami to Professor Stephen Ullman, the Director of the Center of Health and Management and Policy in the University of Miami. There is a sense that Miami is the next big focus of the outbreak in the U.S. Tell us a little bit about what's going on and about the policy that we think we should be taking.
Thank you very much. A great conference that you're leading here. Yes, we're very concerned here. What's happening is that the corona is basically moving into the southern part of the United States. So whereas it's peaking in the next few days in New York City and in that area, we are not going to be peaking for at least 3 to 4 weeks in Miami and South Florida. In Florida alone, we had 2,000 more cases overnight than the day before. So very significant increase going on. A major concern, I'm a health economist and healthcare policy person by background, is an economic aspect for our healthcare systems in the United States. We have over 35 million people uninsured in our country. We do not have universal health care. And we just added another 10 million to our uninsured rolls over the last 2 weeks as people have lost their jobs, and tens of millions of people who are underinsured. So as they now load into our healthcare systems in Florida and into the United States as a whole, the impact on our healthcare systems will be significant, especially because they've also foregone their elective surgical procedures. So we're very concerned about the long-term impact on the healthcare industry as a whole and our ability to meet the needs, not only of individuals, but for the healthcare population as a whole.
Thank you. Thank you so much. Thank you. And from Miami, I want to move to China to Gal Goren, the CEO of Temi, who is a robot remote that's helping with remote care, was doing the work in China and now is availing itself to other regions. Gal, could you give us a little bit of a sense of what this robot does?
So thank you, Ariel, for having me here today with you. I just want to say in a quick note that it's amazing to see China slowly recovering every day due to the massive implementations of procedures over the entire population. And I hope that the rest of the world will follow. I will start with a short movie clip in order to give you a sense of what it's about.
Unprecedented challenge for us humans. But now Temi is on the front line of this crisis. The bots autonomously move between patients, providing remote video chat with doctors and nurses, even taking their temperature. Right now, we need all the help we can get.
So basically what we can do with Temi is to minimize the interaction between the medical staff and the patient by this fully autonomous robot that can navigate between point A to point B in a very, very intuitive way. Since Temi is an open system, every hospital, every elderly care system, facility can implement any kind of add-on to Temi. What you saw in the movie was a thermal temperature body check. You can implement other devices like disinfectants, like even delivery food to the patients. So the main idea is to minimize the interaction between the medical staff and the patient by remote control. We can see it now in hospitals and elderly care facilities in Hong Kong, in Japan, in Korea, also in the USA, and soon we will see it also in Israel. And again, the idea is to bring as natural as possible the way that people can interact with each other. It's also very important to the relatives of the patients that cannot meet them on a frequent basis. And using the autonomous navigation abilities of Temi, this can be done in a very, very simple way for any facility at a very short time of implementation.
Thank you so much, Gal. I also want to acknowledge Ilan Kaftal, who is a partner of ours, an advisor to the fund, and is doing so much work both here in Israel, in the north, in the Galilee, in the Tzfat hospital, and also in the United States in so many locations. Thank you, Ilan, for joining. And now I want to go back from China to Israel, to a company called Datos Health, to Uri Betesh, the CEO, who's helping with remote care designed to support hospitals across the world and helping keep suspected corona patients at home while still providing them with optimal care. So it's basically the future, putting the home with hospital facilities without needing to come to the major medical center. Uri, please tell us what you're doing.
Thank you, Ariel, and it is a pleasure to be here. I will keep it short. In Datos, we provide remote care and telemedicine with a very flexible platform that can adopt different protocols. What we did when the corona outbreak started, we basically designed a home hospitalization program for positive COVID-19 patients. It is now being deployed by the Ministry of Health here in Israel for all positive corona patients. It's already has been deployed both in the United States, and it's also now being deployed in Italy. The main purpose of that program is to basically protect the hospital from overflooding them with positive COVID patients, and to keep them at home as much as possible and protect the care team. And another great benefit is the ability of quarantine physicians or GPs to work on the platform during the quarantine and still provide care to people at their own home. We do that, and in addition to that, many of the hospitals actually contracted us to transform all the regular ambulatorial clinics inside the hospital to be virtual in a matter of a day. We do those two programs here in Israel quite intensively in the States and also in Europe, starting in Italy. Thank you.
Thank you so much. Thank you. I think many of us see this as the future, where if we can have in the homes an environment which is similar to the hospital and can treat ourselves both in this case and perhaps in the future as well, it will take a lot of the pressure off the big hospitals and will allow the facilities that we have at home to serve us perhaps with a similar level of care. Thank you. It's a visionary way forward. And now last but not least, I wanted to address Matan Melamed, who's the CEO of Thermogate, takes temperature from more than one person at a time. It is a gateway for public places, supermarkets, and other areas where you need to look at a group of people and have a simple, fast, effective, non-intrusive way to take the temperature. Compared to the handheld thermometer, it is more accurate, it's faster, and we all know that measuring your temperature says a lot in these days, and so this could be help to to public places, and we know that we will need that in the future as we try to go back and bring people back to the workplaces. We will need devices like that to help us cope and understand what's going on. Matan?
Spot on. First of all, I want to thank everybody on the call. Really, people are doing so much. So, a little thank you from me, or a big thank you from little me. Back to Thermogate, I want to jump quickly to the movie and just show how dynamic and how quickly the whole process is. All the person needs to do is just stand in front of the device. You can see the monitor on the right-hand side, and as it detects their faces, you have a green light here, good, shows you the temperature, and if you have elevated body temperature, it shows the red light. So it's all super intuitive. This is real-life testing with real-life people coming into the supermarket. Very smooth process, self-service, but also accurate, as you said, because those devices, those thermal cameras, and the way we do it is way more accurate than those handheld devices. We test the entire face. We don't test just a single part of the face. So it's more accurate, more AI built in, and it's also safer because there's no close proximity between the tester and the person. And as you said, Ariel, and thanks again for everything that you guys organized, we believe this will be in every bus station, every mall, every hospital, school, any venue, theater, stadium. It will be I think this is becoming the new standard. And we are happy to share it, and if anyone is interested, I'm sure they can get our details from you. We'll be love to be in touch.
Thank you, Matan. This is exactly what we're looking for, the kind of devices that we will need in order to cope. I just wanted to remind everyone that there are 1,288,080 confirmed cases of coronavirus today in 159 countries. There are 70,567 deaths, 272,000 people recovered, and the numbers, unfortunately, are still going up in a big way. It is not just a health crisis, it is also an economic crisis. People around the world have lost and are losing their jobs. And what we need to be doing is we need to be connecting, we need to be working together in order to succeed in overcoming this on a medical level and overcoming this on a social level. So I wanted to wish everyone a happy holiday, whether it's Happy Passover or Happy Easter. The Ramadan is not for another month and a half or so. And wherever you are, please accept our best wishes for health, for being with your families, for keeping safe, for sharing information, and for allowing ourselves to help each other as we fight this thing on a global level. Technology people, doctors, nurses, medical staffs, you are the soldiers on the front line, and we salute you wherever you are. And policymakers, please be open with the mistakes that some people, including yourselves, are making, so that you will have the chance to correct it in time, because it's never too late to take action in policies that are important. So thank you, everyone. Chag Sameach, Pesach Sameach, and we will meet again. And we hope that after the holiday, we'll be able to have a seminar that will look forward to see how we can go back slowly to be working together and to create a safe environment as we come back to work and we allow the different countries to go back and be creative in ways they were before. And we wish all of you a lot of luck in going through these challenging and trying times. Chag Sameach, and we will talk to you soon. Toda.
Thank you, Aaron.
Thank you.